Thank you, Mr. President. I also rise in opposition to this general omnibus budget before us. As it was said earlier, there are some good things in this budget. There are some parts of this budget that will help large portion of the residents of the state. However, there's many portions of this budget that could have been better, and a lot of things could have been done to make it a lot better. Especially points during the debate on the Senate-originated individual budget bills, especially the budgets that I was assigned to, but a majority of sticking points are still unresolved. Perhaps the most egregious oversight in this entire omnibus is the stubborn failure to expand Medicaid in Michigan in the Department of Community Health. By expanding Medicaid for state residents who are under 133% of the federal poverty level, we had the opportunity to offer health care coverage for more residents while securing federal funding to help pay for it. In total, 320,000 Michiganders would be covered in the first year of the expansion, and 470,000 would be covered in 2021, and Michigan's uninsured population would drop by 46%. By failing to expand Medicaid, that means that hundreds of thousands of uninsured low-income Michigan residents will continue to go without health care coverage. And it means that Michigan will lose out on $2 billion more in federal Medicaid funding here, and we will continue to spend more than $200 million annually on health care costs for those who have failed to be covered. The decision to move forward on this budget without expanding Medicaid hurts our state and our people. As a veteran, I am particularly disappointed that thousands of uninsured veterans.
Members, if you could have the noise level decreased in the chamber while the debate is ongoing. Senator Gregory, please continue.
Thank you again, Mr. President. To continue, as a veteran myself, I am particularly disappointed that thousands of uninsured veterans and their families in Michigan will be missing out on access to health care due to the legislature's failure to expand the state's Medicaid program. But it's also going to hurt our businesses. States that do not expand Medicaid leave employers exposed to higher shared responsibility payments under the Affordable Health Care Act. The associated costs to employers could total $876 million to $1.3 billion each in the 22 states that have opposed or leaned against or remain undecided about Medicaid expansion. Finally, the majority of people in Michigan support Medicaid expansion. A new poll says that 60% of Michigan voters favor expanding Medicaid through the Affordable Health Care Act. A memorandum by the nonpartisan Senate Fiscal Agency concluded that the decision whether to expand Medicaid is not a fiscal one, as it is unlikely that expansion would lead to any cost by the state in the first few years. And that is the most insulting and appalling part of this, that the decision is not policy or logic-based, but rather politically driven. If this budget is not based on fiscally sound reasoning, since this budget is not based on fiscally sound reasoning and policy-based decisions, then you are not doing your jobs, and that is why I am opposing this budget. Mr. President, I ask that my remarks be printed in the journal and my remarks be treated as my no-vote explanation.